Hi, I'm Richard Rahdon, the plastic surgeon here at Body Recon Cosmetic Clinic. Today I want to talk you through what to expect on your very first consultation with me if you're coming in to discuss something surgical. So first thing is you're going to be coming through our front door into our lobby area here, and you'll catch up with Di over there, who will check you in and perhaps get you to fill out a form or two if you haven't already done that in advance. The next step is to come through to the waiting room, so follow me down. And you just take a seat in this lovely area here and just wait a few moments, and I'll do my best to run on time. When you come in for the consult, I'll get you to take a seat over here. I do love it if people can try and leave their kids at home for this type of surgery consult, because it can be a little tricky. So we'll just simply have a chat. I'll have a look at your referral. I'll ask you questions about your health in general, and I'll also ask you about your needs and requirements for surgery. That's the most important part. We'll get to the bottom of why you're really here. Once we've done the consult, I'll most likely need to take some photos. There's a couple of things that you might be asked to wear. For example, a black skirt, which I generally use for all photos of the body, unless we're looking at thighs as well. And then if we're looking at breasts, we might be asking you to put a non-padded bra on and possibly the white top as well. For all the photos, you won't be wearing garments covering the areas that we're interested in. For example, if you're having breast surgery, you'll just have the skirt on without a bra. All the photos are taken here on this little clock face. And we start by taking the photos in a forward position, 3/4, side view, etc. For facial things, the photos are pretty much the same. If we're looking at breast enlargement surgery, we may well be trying some implant sizes on. These are not real implants, but they tend to simulate what implants might look like inside a non-padded bra. That's usually done over a few minutes, and you can work out what sort of size would suit you best. After the sizing, we might need to do a few measurements. But after that, it's pretty much time to quickly get dressed again, have a seat, and then we'll have another chat about the logistics of surgery. For example, what time of the day you might come in for your operation, and whether you'll be in overnight, or whether you'll have drain tubes, or what type of dressings, or what sort of garments you need to bring along. Another important part of our conversation will be potential risks and complications. Not only just what may occur if you go off track, but how we're going to sort it out if you do. I hope you found this useful to prepare for your future consultation. And don't forget, there's a lot of online resources and before and after galleries on our website. See you soon.